Thanks so much for joining us for Healthline 3. I'm Wendy Redman. The kids are back in school now, and that means they're passing along those germs. So today we're talking about the flu. Even though it may seem a little early to talk about vaccinations, we've already seen a few cases of the flu in Shreveport. So here to tell us a lot more about what we can do to stay healthy and keep our families healthy, we have Dr. Paul Bracey of Urgent Care of Louisiana. He's going to be answering all of your questions about the flu for the next half hour. We really want to encourage you to ask all of the questions on your mind. If you're online, it's real easy. Just fill out the information right there on your screen and submit it, or you can always give us a call during the show. That number is 318-219-4569. We're going to be answering all of your questions until 12:30. So August, and we're talking about the flu.
It is a little early, and it seems a little early at least, but we are seeing cases of type A influenza in Shreveport already.
Okay, so you say type A. There's type A and B.
Right.
Go through what that means.
Two main types of the flu, type A, type B. It just has to do with the way that virus is formed, the proteins and things in that particular virus, but it doesn't really have anything to do with how bad the virus is if you catch it. So really type A and B are just two main categories. Now we are seeing type A right now, which if you're going to see a summertime flu is not that surprising. Type A is what the old 2009 swine flu was, which was one of the first warm weather flus that we had kind of encountered. But so that's what we're seeing now. It's type A, and we're not seeing it in large quantities. It's just kind of sporadic cases. If you look at the CDC monitors this on a weekly basis as we approach flu season. In Louisiana and other Gulf states and some of the other states around the periphery of the United States are seeing sporadic cases, but nothing on an epidemic sort of proportion. So it's not scary, but it's good to know that it's here. Knowing that it's here hopefully will urge people to get those flu vaccines.
Especially a good thing to think about as kids are back in school, because you know they're coughing and sneezing on each other and just passing it around and then bringing it home to you and your family and all of that.
That's right. And flu is highly contagious, and you can have symptoms for 1 to 4 days before you even develop. I mean, you can be contagious for 1 to 4 days before you even develop symptoms. So you're contagious before you even know you're sick. So for that reason, you know, prevention, an ounce of prevention is worth a pound of cure. So getting that vaccine is the most protective thing you can do to prevent yourself from getting the flu this season.
So tell me about the vaccine that you would get now if you went.
Well, there are multiple different options now. Historically, all flu vaccines have protected against 3 strains of the flu, and the CDC, in conjunction with the World Health Organization and other regulatory bodies in other countries, kind of have a surveillance program globally where they look to see what pathogen is going to be the more dominant viral strain for that following year, and they try to predict what they need to cover. So the CDC decides which 3 strains that we're going to, as the United States, that we're going to cover, and each country decides its own. So the vaccine, that's one reason why the vaccine changes every year, because a different strain of flu tends to go around. Now, even if it's the same strain of flu, they still recommend getting another flu shot because your immune system wanes over that kind of a 12-month period of time. So you do need that booster. But that's kind of the gist behind the flu shot program. Most of them, like I said, protect against 3 strains of flu. There is a new one called a quadrivalent vaccine that protects against 4 strains. The main ones that most people will use will be the standard shot, the flu shot, that protects against 3 strains. Has been around for decades and has been the backbone of the vaccination program. The flu mist, which is a live virus actually, but it's not one that can give you the flu. It's what we call an attenuated live virus. So you can use the flu mist, which is the vaccine in the nose, the nasal spray in the nose. There is a newer one in 2011 to 2012 was the first year it was introduced, the intradermal vaccine. The intradermal vaccine is only recommended for use in patients who are 18 to 49 years old. So if you fall outside that window, your doctor may not use that flu vaccine for you. But that's the one with the really tiny needle that goes just under the skin, as opposed to the muscular injection.
Okay,
So
is one of these, do you have better results with one of these over top of another?
No, they're all shown to work equally as well.
Okay.
Some patient populations can use one and not the other. Because the flu mist is a live virus, it is not recommended in pregnant women or in people who have impaired immune function. So,
Okay.
you know, and some people you may want to speak with their primary care doctor before deciding to take a flu shot. Even somebody who's actively undergoing chemotherapy may want to talk to their oncologist. And if you have a severe immunocompromise from some sort of another, some of those are genetic, some of those are acquired, then you may want to talk to your physician before opting for the flu shot. But chances are, if you have those, you've already spoken to your doctor about it.
Okay, what about your little ones? Is there an age that you must be at least a certain age to get these?
Yeah, the flu shot is recommended for children 6 months and older. So anyone over the age of 6 months can get a flu shot. If you're between the age of, of day 1 and 6 months, then flu vaccines are not an option. If you do catch the flu, there are medications that can be used to treat the flu. And if you have a little one who tests positive for the flu, who's younger than 6 months of age, if they're older than 2 weeks, they can use Tamiflu. So, so there are treatment options, even if you're not old enough for the vaccine yet.
If you think you've already had the flu, should you still get the vaccine?
Absolutely, absolutely. Now keep in mind that you had one flu strain. The flu vaccine covers at least 3 strains, depending on the shot, sometimes 4 strains. So you could still catch the other 2. And we saw that this past flu season, this last December, where we would have patients present with flu A, and just a few weeks later they would come down with flu B.
Goodness.
I mean, it's extremely unfortunate, and obviously impacts your ability to go to work. But it is possible. So if you've had that flu shot, then assuming the CDC has predicted the strain correctly, which they do a pretty good job of that, then you would be protected against those. And there is a misconception that the flu shot will give you the flu, and that is absolutely not the case. The flu shot is not live virus. It has killed viral particles, and so it triggers your immune response. So there was actually a study, we talk about this shot gave me the flu because people will sometimes develop symptoms that are similar to the body aches that you have because your immune system's gearing up. It's ramping up to recognize and fight that flu. So, for a couple of days, some people may be a little achy, but there was actually a study that looked at patients, people who received the flu shot versus people who received a saline injection, and there was no difference in those symptoms between the two. So, I wouldn't say that saline causes the flu either. So it really doesn't. It does protect. It is our first line of defense, and highly recommend getting the flu shot. I get mine every year. My children get theirs. Now, like I said, there are some patient populations that can't, and one of those things we've heard about before related to flu vaccine is the development of a neurologic condition called Guillain-Barré syndrome, which is classically is an ascending paralysis, and that is it is possible with any vaccine, and has more to do with how your immune system is responding and reacting to that. But so if you've ever had that particular process involved within a couple of weeks, a week to 2 weeks of getting the flu shot, then you should not get the flu shot. So there are some cases where you shouldn't get it, but those are very rare, kind of few and far between, but they do exist. So it's just kind of one of the known complications, and if that's ever happened to you personally before, then you don't want to get the flu shot. Another group of people is if you have a severe allergy to eggs.
Right, I've heard that.
The flu vaccine is cultured in eggs, so if you're allergic to eggs, those proteins are involved, so you don't want to get. If you have a severe allergy, then you don't want to get the flu shot. Mild allergies, are probably okay. And again, it would be another thing to talk specifically between you and your doctor about to see if that's something you should do.
Yeah, to make sure that you're healthy, because otherwise, if your doctor gives you the go-ahead and you seem to be healthy all around, there shouldn't be any apprehension for anybody to get the shot, right?
That's true.
Because I know a lot of people are very
true.
apprehensive to get a vaccine.
Right, and studies have shown that vaccines do not, other than these known complications like Guillain-Barré, but when we compare it, when we look at, there's a lot of kind of heated argument on learning disabilities and things like that related to vaccine use, the thimerosal that's in other vaccines and things like that. But with the flu vaccine, that is not something to worry about. Studies have shown that it does not cause any other sort of learning disabilities or anything like that. You know, as far as all the available data that we have, flu vaccination is safe, it's effective, and getting your shot early and getting it annually is the way to go.
If you get it now, do you have to refresh later? Because I know, you know, people don't think about getting the flu shot very often, or at least I don't, until maybe November, December, because isn't around January the time when a lot of people wind up getting sick?
Yeah, our flu season tends to start, I mean, it can change, the window can kind of widen and narrow a little bit from year to year, but our flu season tends to start in November and carry through the spring, so March, you know. If you wait until December, you run the risk of catching the flu. So it takes about 2 weeks for that flu shot to kind of rev up your immune system. So if you wait too long, you know, it's never too late, but you just kind of, you're playing Russian roulette, or you're playing craps. So you gotta, getting it early is the recommendation of the CDC.
Getting it now is going to protect you through
flu season.
Flu season.
Right.
And you said the CDC makes these recommendations every year, saying we think these 3 strains are going to be the most
right.
problematic this year, I guess, that we're going to see these the most. But sometimes that can be hit or miss. Do we know how effective their predictions are yet?
Their predictions are usually, if I remember right, around 80% correct.
Okay.
So, I mean, you know, that's a pretty good success rate at trying to predict the future. So, even if they, and the other side of this is, even if they miss the prediction, say 2 of the 3 strains are right, the third one is not right, you can still develop some crossover immunity, so the shot that you received can cross over and cover that other flu strain. You know, it just depends on how widely apart on the kind of genetics involved that the 2 flu strains are, but you can have some crossover immunity. So your immune system, while it may not be ideally geared up against that bug, it will at least be partially geared up against that bug, and you can have some partial immunity that can reduce the severity of your symptoms or reduce your chance of catching the flu, even though it may not be a 100% match. But
your body kind of knows at least what it's dealing with
right.
at a certain level, so it has a leg up.
Right, exactly.
All right, that's a good way of thinking about it. What about for the elderly? Do they tend to get a concentrated version of the shot? Is there anything different that they need to be doing?
They do. For patients who are 65 years and older, there is a different flu vaccine that has about 4 times the amount of antigen in it to trigger their immune response. As we age, our immune system naturally kind of wanes a little bit. We don't have the ability to mount that response at age 65, say, that we did at age 20, and all along in between. So the shot that you get when you're 65 and older is a more concentrated version of the same shot that everybody else gets. It's the same. It fights against the same viruses. It's just a little bit of a stronger dose. So.
Okay, I believe we do have a caller on the line. I didn't catch your name, but you're on the air. What's your question?
You don't take the flu shot.
I'm sorry, can you repeat that?
You do not take the flu shot. If you take the flu shot, you're going to get the flu. My father took the flu shot, he got the flu. And a teacher takes the flu shot, her got the flu. You jerk don't take the flu shot. You take the flu shot, you're going to enter it with a bag at the flu. And the people in the nursing home, they take the flu shot, they get sick for the flu. Every time they take the flu shot. So the doctor don't know why he.
Okay, so that is a common concern for a lot of people. They feel like, okay, you're going to get this shot and you're going to get sick.
Let's
talk about that a little bit more.
And it's a very common misconception. Many people believe that if they get the shot, then they'll catch the flu.
Yes.
It is, I mean, quite frankly, physiologically impossible to catch the flu from the shot. The problem comes in that around the time that you start getting your flu shot is flu season, but it's also cough and cold season. So you will tend to get, you're still vulnerable for any other virus that causes infections, like rhinovirus, adenovirus. I mean, there's thousands of viruses that we come in contact every cold season that we typically successfully fight off, but they don't need much of a leg up to take advantage. So even though you've had the flu shot, you can still get any number of cough, cold, the common cold kind of illnesses. Mm-hmm. So it generates sort of a memory bias in the way that we recall events, which is something that's kind of happens all the time with humans. But so you associate the shot with I got sick, and then even though the association is not a causative association.
Or
right?
It could be that you didn't get it early enough.
It could
or
be.
It could be that there was maybe a different strain out there that you weren't protected from in that shot. I mean, it could be a lot of different reasons, right?
There are many factors as to why you might get sick, but you're not catching the flu from the shot because that's all dead viral particles. They're not even.
Well, go over a little bit of this too, because you can have the worst cold in the world and have just horrible symptoms and a horrible time getting through that cold. But how do you know if you have a cold or if you have the flu?
Typically, flu symptoms are going to be much more severe. So the body aches, the fatigue, the malaise are typically much more severe with influenza virus than they are with other standard cough and cold viruses like rhinovirus. You tend to have a fever with the flu. You don't absolutely have to have a fever, but fever is a common presenting symptom with influenza infections. Common colds tend not to be quite as severe. They tend to be more associated with runny nose and those kinds of symptoms than the flu. But the other systemic symptoms are not quite as severe as with the flu. Now, the way to really know is to get tested. I mean,
yeah.
And if you're interested in being tested, the time frame really is in the first 48 hours of symptom onset, because that's the only time frame, if you're generally healthy, that we can effectively treat the flu. And some people will argue maybe not so effectively, but the two medications that I mentioned, like Tamiflu and Relenza, that are used to treat most cases of flu. There are others that are only good against a certain strain of the flu instead of both, but Tamiflu and Relenza have become kind of the two main treatment options. You have to initiate treatment with them for the first 48 hours for them to do much good. Now, in a generally healthy person who has an intact immune system, who tolerates the medications well, can finish the course, it really only reduces the length of illness by 1 to 2 days. So if you're talking about a generally 2-week, 14-day kind of an illness, it may or may not be worth it to you to go in and get tested to take the medication. For some people it is, and for others they don't want to. So it kind of depends on your goals personally as far as trying to get over the flu. And if you do want that, then you have to really present in the first 48-hour window, because outside that window for healthy people, there really is no benefit. If you have other medical conditions, though, such as heart disease, congestive heart failure, diabetes, asthma, emphysema, then that 48-hour window is not as rigidly applied. You can have some benefit outside that 48-hour window. And those people who are hospitalized with influenza frequently will be treated with Tamiflu, and those are the recommendations out beyond the 48-hour window. So there are some exceptions to that 48-hour window rule, but if you want to get treated, the thing to do is get tested for it, which is the nasal swab. swab on both sides of the nose, and the rapid tests are usually back in roughly about 15 minutes. And some are more reliable than others. The sensitivity of those tests usually run around 80% or so, a little higher with some of the newer tests, but that's really the way to know. I mean, you don't have to always rely on the clinical symptoms. Some people will manifest with more mild symptoms than others. So if you just use, the symptomatology, you may overdose, overdiagnose, you may underdiagnose. So getting tested is the way to find out.
Okay, well, obviously prevention is the key, right? But once you have it and you know that you do, you don't want to spread it, right? So you were saying, what, 4 to 5 days before you even know you have it, you're contagious. And then how long after? So
usually you're contagious for 1 to 4 days before you develop symptoms. And then after you've developed symptoms, you're contagious for up to about a week. So 5 to 7 days generally. So you're still contagious for that once you develop symptoms for the first week of your symptoms. Some people, depending on your immune response, may be contagious even longer than that. So it kind of depends. It's very dependent on you as a person and your immune response to that virus. But so you definitely don't want to spread it. The way to prevent kind of spread, one, is to not go out into crowds. Don't expose other people. If you're out and about, if you're coughing, if you're sneezing, the way they used to tell us to cover our hands, use our hands to cover our mouth and nose. That's no longer the case. Now they recommend covering it in your elbow.
Right.
And obviously, frequent hand washing is you can't beat it. You can't beat it. I think we've talked about that in prior segments.
Yeah.
Hand washing and hand hygiene is very important as far as spreading any kind of infection. If you use tissues, which are perfectly fine to use, but if you use tissues, use them once and throw them away. Don't use them and cough and sneeze into them and put them in your pocket, or save them, because now they have virus on them and they can serve as a means of spreading the virus. So a single-use tissue, throw it away. Frequent hand washing after you've coughed or sneezed. If you don't have access to soap and water to wash your hands, then a second line kind of means of treatment for that would be the use of the alcohol-based sanitizers, and just kind of, for the most part, kind of quarantining yourself.
Yeah. Maybe not going to work if you don't have to.
Exactly.
Well, what about for kids? Because you got to make the decision for your child if they're going to be going to school or not. And kids spread like crazy, the flu. So, but that's a lot of time that they would potentially be missing out on school. So what's the recommendation there?
That is. But again, the risk of looking at it from a public health standpoint, the risk of spreading that virus further and infecting the school kind of outweighs the benefit of the child being at school. And you've got to kind of think, if you're that sick and you're at work, you're not exactly functioning to peak capacity, So it may not even be doing a lot of good as far as academic performance to have an ill child in the classroom. It's going to expose other children to the infection, and quite possibly prolong his or her recovery period, because they're not at home drinking fluids and resting and doing other things that they need to do to help manage the flu symptoms. So.
Okay. Well, if you don't go to the doctor and you just want to go to your local pharmacy to see, if there might be some medication that might help you out, what would you recommend for people to do, for kids and for themselves?
It is kind of age dependent for pediatrics. For younger children, we usually don't recommend using medicines that have stimulant kind of decongestants in them. So that's why most of those products were removed from the market. They caused more harm than good. So kids are not just little adults. They have a little different metabolism, a little different biochemistry. So we usually say, and we're talking kids that are 8 and younger, kind of an age range, as they reach the preteen and teen years, they start to transform, more looking like adults and acting more like adults as far as their biochemistry is concerned. maybe not behaviorally, but
well, some of them are mature
some of them
lives
are.
beyond their years, aren't they?
And some of us adults are probably less so.
Yeah.
But I got off track. So those the decongestants like the Sudafed and stuff like that. The pseudoephedrine, the phenylephrine, you want to avoid in the younger age groups and stick with the Tylenol, the acetaminophen products, the ibuprofen or naproxen or NSAID groups of medications to help cover the body aches and just the feeling crummy kind of symptoms. You can use, we use in our kids, I think I used, last year, like Vicks Vapor Rub and things like that. If they're particularly young, nasal bulb suction to help clean the nose out so they can breathe more easily. And saline rinses can all help. A lot of times for congestion and things like that, steam will help loosen it up, help it drain. If you look at medicines like guaifenesin, which is what's found in Mucinex and some other over-the-counter medications, they've never really been shown in independent studies to do a lot of good. There's some anecdotal evidence that some people respond to them and others don't. So I usually tell my patients, if you have used guaifenesin in the past and you like it, it seems to work for you, there's nothing wrong with using it. But I can't really, with any degree of medical certainty, predict that it will help if you've never used it before. So for adults though, using the same kind of measures plus the decongestants can help a lot. And the biggest thing is going to be fluid intake, rest and fluids.
Lots of water.
You hear people kind of joke that that's what doctors say about lots of things, but rest and fluids, that's going to really help your body kind of fight this off, prevent dehydration. It's easy to get dehydrated when you're sick, especially with a bug like the flu.
Yeah.
Any amount of fever increases the odds of you becoming dehydrated because you're losing more water than you normally would. Right. You're sweating, your respiratory rate goes up with fever. Every time you exhale, you're exhaling 100% humidity. So, you are losing what we term insensible losses, things that you can't quite measure, but you're losing water. So staying hydrated becomes really important in those kinds of cases.
Well, I have to ask you this because I was one of these kids. When you're a child and you have the flu, a big symptom is that you can't keep food down. So what do you do with a child when you give them the medicine that they need, say they're running a fever, so you know that they need that medicine, and then up it comes right away? Are you able to give them more medication? Should you wait for the recommended 4 to 6 hours or whatever it says on the box? What do you do?
It kind of depends on the time frame. If it were immediate, if you say gave your child a dose of acetaminophen and they, as soon as it passed the gullet, so to speak, it was coming back up, then there's no way that they absorbed any of it. You could redose, or another option is to give it a little bit of time and dose with a different class of fever-reducing medication. So if you used acetaminophen, try Motrin or ibuprofen. If you used ibuprofen, try the acetaminophen. Now, oddly enough, GI symptoms are common in children with influenza. The term flu bug, as far as referring to stomach bugs, is a misnomer. The flu does not tend to cause a lot of nausea, vomiting, and diarrhea. The exception to that is in pediatrics, and also with the swine flu. H1N1 was oddly enough one that caused a lot of GI symptoms even in adults. So, but as a general rule, catching a stomach bug that people term the flu bug is not actually flu. It's not influenza. It's some other pathogen. But in children, there are medications that can be used for nausea. There are non-sedating medications, so that you don't have to use promethazine, which is a Phenergan, which causes a lot of sedation. So you can use other medicines that don't. So those are also treatment options if they have GI symptoms.
We've got about 30 seconds left. So if people do want to get the vaccine, where do they go?
We have a vaccine in stock right now. We're expecting a shipment of more injectable vaccine. We have Flu Mist. And we'd be happy to help people out. Yeah, Urgent Care of Louisiana.
All right. Well, thank you so much for being here. We do appreciate it. Some great information. So I hope everybody stays healthy this flu season. That'll do it for us. Thank you so much for joining us for this edition of Healthline 3. We'll see you right back here next.